Good evening. Tonight we take a closer look at a dangerous bacterial outbreak that is affecting hospitals across the country. This bacteria infects patients with weakened immune systems and can cause life-threatening complications. The frightening bacteria we are talking about is called Acinetobacter baumannii. Acinetobacter is an opportunistic bacteria that poses little threat to healthy individuals, but can quickly become life-threatening to a patient with a compromised immune system. How did this bacteria get into our hospitals? Acinetobacter emerged originally in U.S. soldiers fighting in Iraq. Soldiers with open wounds contracted the bacteria in makeshift frontline surgical tents. Once stable, these soldiers are transported through many medical facilities on their way home to the U.S., spreading the bacteria along the way. Ultimately, the bacteria end up in the U.S. hospitals caring for these soldiers. Acinetobacter enters most patients through invasive medical equipment, such as catheters, respiratory ventilators, and IVs. This particular bacteria has the ability to survive extremely well on surfaces by producing both a protective capsule around itself and a wet biofilm to prevent itself from drying out. These mechanisms allow the bacteria to survive outside of its host for extended periods of time, often living happily on hospital equipment. When a patient does become infected by Acinetobacter, the disease characteristics may vary. The most common form of disease is pneumonia. However, patients can develop blood infections, meningitis, urinary tract infections, and respiratory infections, all depending on the bacterial route of entry into the body. For example, if the patient breathes in the bacteria, the patient will likely develop pneumonia. By themselves, most of these diseases are treatable in a hospital setting, but as mentioned before, only patients with struggling immune systems tend to become infected with Acinetobacter, and often the infection causes life-threatening complications to an already ill patient. So why don't doctors simply give patients a course of antibiotics and send them home? The answer lies in the tricky antibiotic resistance mechanisms that Acinetobacter has developed. Acinetobacter has what are called pathogenicity islands, which allow the bacteria to easily swap DNA with other bacteria. Often, the segments of DNA that are shared between bacteria are those which assist in antibiotic resistance. These genes develop mechanisms such as producing enzymes that break down antibiotics and protein pumps which actively pump antibiotics out of the bacterial cell. With all of these antibiotic resistance mechanisms, Acinetobacter has become one of the most difficult hospital bacterial infections to treat. The most effective means of treating Acinetobacter is to test the particular strain which the patient is infected with for antibiotic susceptibility. Every strain of bacteria varies slightly, and finding its weakness is key to prescribing the most effective antibiotic against it. In reality, the best treatment for Acinetobacter is preventing the infection of patients altogether. Hospitals around the country are evaluating and improving sterilization techniques and investing in training every hospital employee on the importance of proper hand washing. While Acinetobacter still poses a very real threat to our hospitals, efforts are being made nationwide to eliminate these infections. With prevention techniques and ongoing antibiotics research, U.S. hospitals hope to decrease Acinetobacter infection rates and ensure increases in patient safety.